My name is Betoul Baz, and I'm a second-year PhD student at the University of Queensland Centre for Clinical Research, and I'm sponsored by King Faisal Specialist Hospital and Research Centre in Riyadh, Saudi Arabia. So in the past 2 years of my PhD studies, I have been given the chance to speak at a national conference and attend a couple of various conferences. I also won the Graduate School International Travel Award, which I will be using in a couple of months from now to present my research data in France and Netherlands. And I will also be meeting with experts in the field to take my research to the next level. What I'm researching in my PhD project is the genetics of skin wound healing, and what I aim to identify is genes that dictate how well a person's skin wounds would heal. And I'm also studying a small population of stem cells that are resident in the skin, and I'm studying how they function to help the skin wound healing process. Skin wounds are quite universal and they affect everyone. There aren't a particular part of the population that are more susceptible to having skin wounds. However, the elderly and people with other comorbidities such as diabetes have an increased risk of having what we call chronic wounds, and these are wounds that take a very long time to heal. And these people go through a vicious loop of changing dressing and just supportive treatments, and then the treatment never works. So these are the type of people who would benefit the most from the kind of study that I'm working on. It would be perfect if we can tailor the therapies to those patients' needs and have more effective therapies developed afterwards. During the course of my study at the University of Queensland, I have been so privileged to work under the supervision of Associate Professor Kirash Khosrow-Tehrani. I have learned so many things from him. I learned how to design experiments, how to test hypotheses, how to interpret scientific data, and most importantly, how to communicate them. To me, the supervision mentorship is quite invaluable. It's indispensable, and it's a real asset. Since 2012, since I have been sponsored by King Faisal Specialist Hospital and Research Centre in Riyadh back in Saudi Arabia, I have had continuous support from them and continuous support from the university to take my research to the next level. There has been unlimited resources and unlimited support which I have received and which I'm very thankful for. What we are hoping for in the University of Queensland is find effective therapies for skin wound healing and skin cancer. And in my opinion, with all the efforts of all the researchers and all the facilities that we've got, this is becoming a reality.